Well, this month we've been talking a lot about the importance of heart health since it is Heart Month. And we're also learning about the latest technologies helping to care for our hearts over on the east side. Dr. Maheer Gandhavadi from Cardiac Electrophysiology at Overlake Medical Centers and Clinics and Evergreen Health is joining me now. Thank you for being here.
Thanks so much for having me.
So tell us about this incredible heart and vascular care program at Overlake.
So Overlake's Heart and Vascular Center has partnered with Evergreen Health Heart Care to provide comprehensive heart care services for residents of the East Side and beyond. So we call this partnership the East Side Health Alliance, and basically it provides a wide range of cardiovascular services, including cardiac rehabilitation, cardiac surgery, preventative heart care, and even specialized treatments like valve treatments, treatment for blockages, or heart rhythm issues.
You know, I bet that the average person doesn't realize this huge, effort and movement to keep everybody's hearts healthy and happy. But let's talk about this, the left atrial appendage, or LAA closure program. What is it and who does it help?
That's a great question. So as a cardiac electrophysiologist, our focus is really on heart rhythm issues. And one of the most common heart rhythm issues that we see is an irregular heart rhythm called atrial fibrillation, or AFib. And the biggest risk from AFib is that it can lead to blood clots in your heart that can cause strokes. Normally we have to put patients on blood thinning medicines to reduce their risk of blood clots and protect them. But for some patients, this just really isn't an option. They have bleeding issues, medication intolerances, and so this left atrial appendage closure program provides them an alternative option instead of having to be on blood thinners long term.
So can I ask you kind of the specifics of what if somebody is in AFib? How does the LAA procedure prevent that from happening?
So the big thing about AFib is that instead of kind of squeezing regularly, your heart's just kind of shaking on top, and that can cause blood to pool in this little pouch in the heart called the left atrial appendage, or LAA. And for folks who can't be on blood thinners, what we can do is we can insert a tiny little device through the vein here in your leg and go up to the heart and basically insert that device in the left atrial appendage. And what that does is it seals it off so that blood clots can't form and blood can't get in, and it protects you from strokes.
Wow, so it just keeps everything moving and not pooling.
That's right. So it basically closes off that area where blood pools, allows the heart to do the rest of the job that it's supposed to do, and protects you from the strokes.
I literally, modern medicine is just so amazing to me that you can do this now. You are, though, the one and only team of specialists that can perform this procedure on the East Side. Isn't that right?
That's right. So we have a great team of individuals who work together to make this kind of procedure happen, and this is really an exclusive service that we provide to residents of the East Side and beyond.
It's amazing to me when you think about the complexities of the heart. You mentioned that you are an electrophysiologist. The heart is electric, right? This is something that we are needing to make sure we take a focus on every day. How does somebody know when something's wrong? Like we were speaking before with this interview started, a lot of people don't even know if they're in AFib.
That's a great question. And with AFib, we talk about the rhythm being irregular and the heart beating irregularly, but a lot of people don't feel that. And in fact, many people with AFib don't have symptoms at all. And sometimes the symptoms are more subtle. It's, oh, I'm a little more tired, I'm a little more short of breath, and maybe my energy level is lower than it was a few months ago. And those are all signs to really talk to your primary care provider, see if there's something else going on. The other thing that's really helpful nowadays are smartwatches. And for a lot of us who have smartwatches, they have detection for irregular rhythms like AFib, which has really helped us diagnose a lot more folks.
That is so good. How can people learn more about the program and the other services that are offered at the heart and vascular level?
So for all of these programs like left atrial appendage closure and the other services we provide, you can go to the Overlake Arrhythmia Center and Overlake's Heart and Vascular Center webpage on the Overlake Hospital website. The great thing about a lot of these procedures is that they're minimally invasive, there's very little downtime, and patients can often go home the same day or the next day.
Oh my goodness, Dr. Gandhavadi, thank you so much for taking the time to talk about this very, very important issue. Again, if you ever think something is wrong, talk to your doctor. You meet nice, kind people like this. And by the way, to learn more about what we've discussed today, please visit the website on your screen. We also have a link on our New Day website. You can just go there and get more information. Well, my friends, you never know, but you might have something of value in your junk drawer. Antique expert Dr. Lori is here to help us appraise an old but expensive iPhone. We'll be right back.
This portion of New Day Northwest is sponsored by Overlake Medical Center,